my name's Leah Morgan. I'm the Living With and Beyond Cancer Project Manager based at Shrewsbury and Telford Hospital's NHS Trust.
And I'm Jessica Greenwood, I'm the lead cancer nurse. Next slide, please. So I'm just going to give you a bit of background about our trust. So the Shrewsbury and Telford Hospitals Trust, which we call SATH, is a district general hospital setting that serves about 500,000 people living with Shropshire, Telford and Wrekin and Powys. So our geography is quite varied. We have areas of both dense and sparsely rural areas, as well as pockets of age variation and also deprivation. From an activity point of view, when you compare us to 160 trusts, we're the 13th biggest referrer of 2-week wait urgent suspected cancer patients and the 22nd highest treating hospital for cancer patients. So that gives you just a bit of context on our demands and the volume of patients we treat, even though we're in a district general setting. From a continuity of care perspective, we work closely with our voluntary and third sector colleagues to provide a range of support for people living with cancer. We estimate that there's approximately over 3,500 people who receive a new cancer diagnosis in our locality every year, and we've got in excess of 50,000 people living with and beyond cancer in our area. Next slide, please.
So in order to support those patients, we developed several initiatives, but two that we're going to talk about specifically today. One of those was the passport. It was developed with patients at different stages of the pathway, enabling us to get an all-around insight into the needs and wants of those at different stages. The passport brings together information about what support services are available for them throughout treatment and beyond. The handheld passport is given at the time of diagnosis and continuously referred to each time they go for an appointment or ring the team for some advice. The patient is also encouraged to take the passport to any appointments that they have with allied health professionals or out in the community with their GP, hopefully strengthening that communication between all care sectors. The aim of the passport is to empower the patient and give them some control back after a cancer diagnosis. Passport also contains clear information about the holistic needs assessment, which is currently completed by the team in the hospital at different stages of the pathway, but could easily be completed by members in primary care at any stage of the pathway as well. The aim of the HNA is for the patient to be able to identify and raise their own concerns to find out what support there is available for them. Within the first 12 months, the GP will complete a cancer care review. The holistic needs assessment gives them a baseline, and both of them talk about what the patient's concerns are, and also with the cancer care review, it will look at any support services in the community that are available for them. Next slide, please. So we've had some fantastic feedback from Passport that's been developed within the trust, including the Passport enabled me to take notes for myself, giving that patient that self-control back, after that diagnosis. It was good to get it when I was first diagnosed. I felt less alone. And also, why is it taking so long to get everything in one place? A brilliant one-stop shop of information. We found that it really helped because they used to get really big, large packs of that information. Next slide, please. So the next thing that we developed was the Living Well sessions. The Living Well sessions have been developed using feedback from patients who have completed the HNA. So the four main topics of concern that were highlighted and used to create the model we currently provide were fatigue, physical activity, emotional well-being and nutrition. So we talk about what those things are, any benefits, challenges or barriers, with the main aim of the session being to learn how to safely self-manage those things away from the hospital setting, but also to recognise when to seek some support should they need. We also talk about support services, and we give that opportunity for people to share their experiences and learn off others. The 11-month face-to-face pilot that ran throughout 2019 proved to be extremely successful, with 321 people affected by cancer attending events in venues throughout the county. When the global pandemic hit, we adapted the model to deliver it online over two 90-minute sessions covering the four topics. Although this limited the numbers that we could deliver to, it still has proved to be positive, with between 6 to 10 people attending the sessions that are held twice in a 4-week period. It enables services in all care sectors to present what they provide to support people living with and beyond cancer. When running face-to-face, we have trained patient volunteers as well as volunteers from primary, secondary and voluntary sectors facilitating at the tables. During the lunch and after the session is finished, those who have come from the different organisations can go around the room, network, introduce themselves and their service. So before the pandemic, the talks were being held with the community organisations as to how we could deliver this model out in the community as a sustainable model. And these talks, I'm excited to say, have recently started to pick up again. We hope that our first face-to-face since the pandemic is going to start at the end of November. However, we've also realised that the online sessions really benefit those who have a long way to travel to attend the face-to-face sessions, and this may be preferred. So therefore, the decision has been made that going forward, both models will be offered for the people to attend. It's all about patient choice at the end of the day. As part of the response to the launch of the online platform, we've been running an opt-out pilot with the breast team where the patient is booked onto the session and contacted by a member of the team to discuss the sessions as part of their pathway following treatment. Another initiative that we ran was the production of the Living Well videos that are available on the SAF website. We worked with several other trusts to develop these videos that could be used regionally to reach an estimated 100,000 people. This involved working together with trusts and community services to create videos to give hints, tips and advice about the 4 topics that we cover on the sessions. Next slide, please. So the Living With and Beyond Cancer Advisory Network was created as from day one we knew that the patient and their loved ones' voices would just give us clear direction and would be vital as to how we developed each of our projects. It's made up of people who attended the Living Well session and gave their consent to want to know more and who wanted to be kept up to date with what was happening throughout Shropshire, Telford and Wrekin. However, this group was not only kept up to date with changes that are happening and developing within our programme, but also invited to other patient forums that are delivered by other organisations and departments. Recently we had a patient engagement event to hear from people living with and beyond cancer about their thoughts and comments about the 5-year cancer strategy that's currently being developed within the CCG by Jessica and her colleagues. The Living With and Beyond Cancer Advisory Network can be offered opportunities to partake in patient forums, events from anybody in the primary, secondary or tertiary care centre with matters covering cancer within our county. Next slide, please.
So one of the other exciting initiatives that we've achieved with regards to integration and continuity of care has been the development of this Cancer Care Navigator role, and these are the lovely ladies appearing on the slide. So I'm delighted these are now fully embedded within our trust. These roles are 100% patient focused and they provide excellent quality and continuity of care. However, these aren't the only roles in place to help support people living with cancer, and Leah's going to explain some more.
Yeah, so we work really closely as well with the community care coordinators and social prescribers who are based in GPs throughout Shropshire and Telford. They're non-clinical roles that support people with long-term conditions, including those who have been diagnosed with cancer. They can signpost, refer to other community services that may be of a benefit to the patient and their loved ones. This role has been in the primary sector for a long time now, and due to how successful it is in supporting people, a new role has been adapted and funded by Macmillan to introduce Macmillan Community Care Coordinators that will help support a number of GP practices with the non-clinical concerns of those diagnosed with cancer, especially those highlighted in the Cancer Care Review. As we move forward in our programme, the hope is that we will continue to build these relationships between primary and secondary care so that the initiatives that we've spoken about today will reach more and more people throughout Shropshire, Telford and Wrekin. And next slide, please.
Brilliant, thank you. And then finally, we just want to end on celebrating with you some of the examples of our collaboration with others and the way that we've shared our good practice. So not only have our initiatives been recognised locally and within our region, which is the West Midlands, they've also been recognised nationally. Our Living Well sessions have been recognised as an innovative model of delivering health and wellbeing information to both patients and their loved ones, and the passport has been identified as a resource for benefiting patients along all stages of their journey, and that includes all of the collaboration we do with other providers. So I've listed here some of the trusts that we've worked with who've been in touch with us. They want to take away our resources and adapt them for local use, and that makes us feel really, really proud. So we're also grateful for opportunities like this that give us an opportunity to share our work with your good selves, and we would welcome anybody to get in touch with us so that we can start a dialogue if you're interested in any of our resources to help people living with cancer. Thank you.